Hello and good evening, everyone. Welcome to 365 Live. My name is Gary Tho, and I will be your host for tonight's live session. So, 365 Live is a platform where we educate the public on cancer and encourage a cancer prevention lifestyle. So, whenever you see this logo right here, you will know that 365 Cancer Prevention Society is currently having a live broadcast. And tonight is going to be an amazing night. We have two speakers planned, and the main talk will be on common cancers in young women. And this is especially brought to you by 365 Cancer Prevention Society, and of course, our esteemed medical partner, Icon Cancer Center. The 365 Cancer Prevention Society has been committed to serving the community through holistic cancer prevention measures since 2003. And this is accomplished through health and nutrition education, promotion of a healthy lifestyle, and of course, our 365 rhythmic stretching exercise. We also provide practical and emotional support and care for our clients and their family members in their battle against cancer. And that's done through our hospital and residential visitations, through counseling services, nutrition consultation, and wellness services. So please do like, share, and comment on all our social media pages and keep in touch with us for the latest updates on our events and activities. Now, speaking of events, we have some amazing opportunities right now. We have 3 screening campaigns: my first colonoscopy, my first mammo, and my first pap test. And so 365 CPS has been championing early detection, and that's why we've introduced these My First screenings, which are a series of screening campaigns that empowers individuals to proactively take steps towards detection, especially early detection, and of course, a healthier future. Now, unfortunately, not everybody has access to these essential screenings, and that might be due to financial constraints. So please help us bridge the gap. And right now, we really would love for your help as we are facing some critical shortage of funds. And we'd love for more people to get access to these screenings. So if you are keen to support these initiatives to help fund these screenings, please take out your phones now. If you're on your phone right now, just screenshot this slide here, scan the QR code to donate, because these few moments that you take to donate is going to go amazingly far in helping a child or a parent or a caregiver around you receive the treatment and the support that they need. So please help us and support us with these screenings. And as we move ahead for the agenda, just a quick reminder: all the information tonight shared by this event, by the speaker, by 365 CPS, are general information, education only, and subject to changes. So please do consult your doctor for personalized and detailed medical advice. Now, I'm getting excited because this is an inspiring moment. We have an inspiring conversation coming up right now. We have a special guest joining us tonight. She is a cancer fighter and a client of 365 Cancer Prevention Society. And in fact, she was featured in Channel News Asia 2 years ago for her fight against cancer, because when she was diagnosed, her company actually fired her and she was let go from her job. And so I've been told this is not uncommon, unfortunately. And yet, despite this situation, she was still able to overcome cancer. And so she'll be sharing her powerful story of navigating her cancer journey. So please help me in welcoming Catherine. Catherine, please come on stage.
Hi, thank you, Dr. Gary, for the introduction.
Hey, Catherine, thank you so much for joining us tonight and being here on this Saturday evening. Do you mind just sharing a brief introduction about yourself and your cancer journey?
Yes, hi, my name is Catherine. I'm from Indonesia originally. I came to Singapore in 2008, and in 2017, I was diagnosed with breast cancer. The type is invasive ductal carcinoma. So the tumor was in my milk duct. My cancer was zero on both estrogen and progesterone. I was HER2 positive. So the doctor said it means that I have the protein that promotes the growth of cancer cells.
Oh no. So when you received that information, how did you feel and what happened next?
So on the day, actually, I feel sad, and I still have hope that I will have baby. I will get married and have baby, but I still single that time. So I having this diagnosis, I searched Google and I heard that the chemotherapy will affect on my fertility. So I reject all the options that doctor gave me. So then, actually, because I had no money for the treatment, and I told my friends that I will go for alternative. Yeah, that's how the first 3 months I went on the situations.
I see. And because you had no money, so how did you get by and what did you do or what happened?
Yeah, so when I first see doctor, right, the doctor say, because I still 36 years old that time, and the doctor say you're still young, and then I also tell the doctor about my situation. I just get fired from my company, and the doctor suggests me to apply for social worker. So, and they also suggested me to do a genetic test, and then so I quickly apply for the social worker, and they wait for the genetic test that they will send my blood to US, and then the result was negative. Yeah, so I'm so happy. And then after going through the alternative treatment for 3 months, actually it's not successful. My cancer cell grow
Oh no.
from 1.9 become 3.5 centimeter. Yeah, it's also I feel this also helped from my fellow cancer survivors who suggested me advice that because he worry about me. I don't want to accept any doctor advice about chemo and surgery radiation. So she said, I think like she just want to listen to what I want to do. Then she said, whatever you want to do, but you have to measure the cancer cell. Is if your treatment going well, the cancer cell should be shrink or smaller. But if getting worse, you should know what to do. So the time then I feel rushed. Then I just quickly go to my oncology, and she asked me to do my PET scan, and I at the same time I also tell the doctor how to pay. I don't have money. Then the doctor say, "Your life is more important than the money." So she say, "I will waive my fee, the doctor fee. She will waive." So every time I come to see her, I don't need to pay for her fee. So
Wow,
very
that
grateful
was
for her.
very generous of your doctor. Amazing. Very
Yeah.
good. And so how did you end up paying? I mean, you'd have to pay for the other
Yeah.
treatments and everything like that. So what happened then?
So what happened then? Initially, I always feel that nobody loved me. This is like my negative thought because I have going through two failed relationships. So then, actually, it's not true. So all my friends, they all love me. So a few friends, they initiated to do fundraising for me. They create an event, K-pop dance. So they sell the ticket, and then the money all proceed to help for cancer treatment. Yeah, but then still not enough lah.
So not enough? What happened?
What happened? I remember previously I have worked in insurance industry. Then my manager back then suggested me, Dai must have this insurance, hospital insurance. So wow, it's like really my safety,
Okay.
save my
Good.
life. Yeah.
Yes.
Yeah.
And
Then
so
the fundraising money is the 10%. The insurance pay the 90%.
Wonderful. And so you mentioned about, it really saved your life, and it really did. So may I ask, how has cancer affected your life or changed, maybe transformed your life now? Is there anything you do differently?
Yes, at the beginning, I feel I'm so unlucky why I have cancer. Then I feel like I already do a good life. I mean, like I'm kind. I do exercise. Why cancer happened to me? I feel sad. But then at the end, I feel cancer actually is a blessing because through cancer, I learned a lot of things. Like a newborn baby, I do a lot of detox on my mind, detox on my emotional, and also my diet. Everything changed. So I was, I become mindful of what I eat, and if like say I go for appointment, what kind of activity that I should go, then not overwhelm. Like last time, I always my schedule always full. Like I want to meet this, I want to do this, and now I have to think about my body. Can my body take it for this? A lot of activities, something like that.
Yes. And sorry, just a very side question, because I think this will help a lot of people. What did you do to detox your mind, your thoughts, and your emotions? I mean, that's very valuable for everybody, not just to fight cancer. So I'm curious, maybe can you give one example?
Detox my mind is like because a lot of negative thought always coming in, because we are human. It's very natural and very normal to have negative thought. So example, when I just cross the road to my office, I always have this thought, Catherine, why you're so stupid? Why like this you cannot do? Then, no. Then I have to replace it. No, actually, it's good this thing happened. So I know where my mistake. Then next time I don't do it again. So I always the to self talk myself. Don't
Yeah.
let the negative entertain my mind. So
Yeah.
love myself. I become encouraging to myself.
Oh, wonderful. So self-talk, yeah, very important, and to reframe, right? Like what you've just said
Yes.
and shared, and to love yourself. Wow, that's very powerful. And like I said, everybody can benefit from this. So besides these amazing and inspiring words, do you have anything else you'd like to say, encouraging words for your fellow cancer fighters, maybe for their family members as well? Anything you'd like to share?
Yeah, actually, sometimes I think my family and my friends sometimes they confuse uh, with me as a cancer patient. Sometimes I become emotional. Sometimes I want to hide from them because they don't know. As I experience the cancer, sometimes I feel annoyed and irritated with people who keep coming ask me, Catherine, how are you? Catherine, how are you? So like, you don't know, I still I still facing this struggle, something like that. Like, but it is not in my heart. Actually, I need them. I need their support, and I need their love so much. Even though I don't show it to them, and I feel the support is sometimes can feel irritated, but uh, my suggestion is don't brush them off, even you feel irritated, and don't pretend that everything is okay. Just be real. When you need help, you can always ask help. And by the way, if you feel the same like I'm feeling now, and like the way I shared before, and if you're not sure where to reach out, you can always reach out to me as well. I'm available in social media, in any social media,
Oh,
TikTok,
wonderful.
Facebook. Yeah.
Yeah, and that's right. I mean, and again, it goes for everybody, definitely for people fighting cancer, but for all of us, we do want and need connection, right? And we
Yeah.
should accept and be willing to connect with people, to accept their help, or maybe even ask for help as well, right?
Yes. Yes.
Yeah. And
I think the connection is really important because even though only 1 minute or 2 minutes, when you have feel the connection, you feel like, wow, it's so good. Something like that. Because I remember where my friend, when I want to brush them off, I don't feel that doing anything. But then this my best friend come and she said, Catherine, I will just stand beside you, and I want to pray for you. You just listen to me. And then okay, then I listen to her prayer. If eventually I also cry, and then after that I also pray together with her. Yeah, so it's like the when you just stand beside the person is feel enough. Yeah.
Wonderful. Thank you so much for sharing that story as well. So the last question that I have for you tonight is, would you advocate mammograms because you had breast cancer? So would you advocate for mammograms as a early detection tool?
As I experience how painful I am when I try out my alternative treatment, because cancer need a measurement to see if we want to live in the real world, not imagination world. So have to make sure if there is a still cancer cell in my body. So I will go for mammogram every year, even though it's painful. Yeah, I know it's very painful, but then we are cancer fighter. We still continue fighting till the end. Don't give
Yeah,
up. Yeah.
wonderful. Don't give up. Fantastic. Thank you so much for sharing your story, for being really true and genuine with us. It's very good to have you here tonight. And yes, please do reach out to Catherine if you would like to chat with her more about her journey as well. All right. Thank you. Any final words? If not, thank you so much for joining us tonight, Catherine.
Yeah, I will type in the comment after this for my link to the social media.
Okay, wonderful. So thanks for joining us. Thanks for sharing your story. And on Facebook, can you guys please share your love with Catherine in the comments as well? And I'll invite Catherine to take her leave. Wow, that was an amazing story. And I'm so glad that Catherine is doing well right now. And now it is my absolute pleasure to introduce our next guest, our next speaker for tonight. So our speaker, Dr. Lee, is a senior consultant specialist in medical oncology at Icon Cancer Center and the program director of Icon's Young Women's Cancer Program. So she treats general oncology with a clinical focus on female cancers such as breast cancer and gynecological cancers. And Dr. Lee was actively involved in setting up a tailored program for young women with breast cancer to help increase awareness and education. So tonight we are blessed to have her sharing on the topic of cancers in young women. So without further ado, please help me in welcoming Dr. Lee to the stage.
Hello, everyone.
Hey, good evening.
Hi, Gary.
Thanks so much for joining us tonight and for being willing to share all of your knowledge with us.
I'm so sorry. Can you all see me?
I seem to not be able to see you. I'm not 100% sure why.
Okay. I do apologize for that. Actually, I am connected. Okay.
While you're preparing, may I just ask you, is there something in particular that you wanted to get across, like the most powerful message that you want to get across for tonight's session while we're trying to find you on our screen?
Yeah, okay. So even though you can't see me, you can still hear me. And
Very
later on, I will be showing my slides. So all is not lost. Thank you, Catherine, for the lovely share. I remember I was in NCC before 2019, before I joined Icon Cancer Center, and I remember seeing Catherine in NCC before. I think she has come a long way. I mean, from when I saw her until now, she has bloomed remarkably. I think she has been very empowered and sharing a lot of positive message. And we really need more survivors like Catherine to really share the message. And of course, the main message that I want to put across is I think screening is very important because ultimately it helps us to, diagnose the cancer in the early stage, and that's when it's totally curable. And we want to see more and more people coming forward with the screening. And I'm very glad to partner up with 365 because they are really supportive and they have programs like My First Memo, My First Colonal, and My First Pap Smear, which I will go more into details later on.
Oh, wonderful. Okay, so what we'll do is, even though we can't see you, and we'd love to see you, by the way, so I do hope the camera does start working, but I'm going to hand the time over to you. You can share your slides and we can hear you perfectly and clearly. So let's continue on with this session because I also look forward to hearing what you have to say as well.
Sure.
Thank you. Take it away, Dr. Lee.
Thank you, Gary. Okay, I hope y'all can see my slides. Okay. Okay, can you all see my slides now? Okay, I will presume that you all can see the slides. So I will start today by talking about cancer prevention and screening and cancer in young women. Of course, we have more and more cancers in younger patients, and that spans, between the two gender, young men and young women. But secondary to Catherine's sharing, I would like to focus a little bit more on breast cancer. So without further ado, let's go on. So here we have this photo of me. Sorry, I just double check if you all can see my slides. Okay, so here I start by showing a photo of my trip in Mont Blanc. So I did a lot of trekking before COVID, and this is what I get. I think it's important that we incorporate exercise in our regular routine so that, it is part of cancer prevention as well. So while in Singapore, we don't have lovely pictures, sceneries like that, we do have our Bukit Timah Natural Reserve. So let's not forget to incorporate exercise into our daily routine. So I think Gary has already kindly introduced me. So this is my resume. And my focus is on general oncology with a special focus on breast and gynae cancers. So the scope I'm going to talk about today is on risk factors of cancers. How can we do cancer prevention? How do we do screening? And also with a special focus on cancer in young women, as well as fertility preservation, which, was a problem for Catherine as well. And also in younger patients, what we focus on is genetic counseling because the cancer is at a young age. I think just to put into perspective, of course, we are not going to do a lot of statistics for this talk, but cancer is the leading cause of mortality in Singapore, and it accounts for 28% the total number of deaths. So if we look at the burden of cancers in Singapore, we see that for women, of course, the main culprit is breast cancer, which makes up for about 70% of the age standardized incident. Following this is colorectal cancer. And, for these two cancers, actually, they are quite prevalent in younger population. For breast cancer, we see that less than 44 years of age, it accounts for about 20% of breast cancer population. And for colorectal cancer, actually, 20% of the patients are diagnosed below 50 years of age. So in younger patient, I think it's very important to be cognizant of the numbers so that, you can potentially consider screening at an earlier age, especially if the family history is strong or positive. Cervical cancer, we see that is number 10, even though it is not among the top 5, but this is because we have a very active and successful screening program. So the 10 most common cancer amongst female is, of course, number 1, breast cancer. If we look at the pink line, we see that, this is rising remarkably, and this is the incidence of breast cancer. But if we look at this graph, we see that the mortality rate for breast cancer is not as scary. It is more or less still fairly flat, because this is in part due to breast cancer screening and picking up of early diseases, which can then be cured. So when we talk about cancer, I think, sorry, can I just hold on? Because I think the staff is trying to contact me. Hi. Oh, can you hear me?
Hey guys, so sorry. We can hear you very nice and clear, Dr. Lee, but I'm just not sure what has happened with both your camera. I can see from the comments, and thank you everybody, Diana and Chelsea, Meridian. Yes, we understand that the slides are not moving and coming through. We have been checking back end meticulously for the last 5 minutes. So we are definitely working on that right now, but we can hear everything you're saying, Dr. Lee. And unfortunately, sometimes these things do happen, and what you are sharing is very important. So we would love to get you back on stage as well. Now, that said, for the people who are tuning in right now, if you do have any questions for Dr. Lee, from what you may have heard, and although we can't see the slides or we didn't see the statistics, if you do have any questions about this first little bit, feel free to type it into the chat now to get a little bit of clarification as well, because we will be having a Q&A, and we can then help to address maybe something that was uncertain or unclear as we try to find a way to share these slides. We are, like I said, in the process of just removing the slides and then resending them in so that we can get them working again. Also, may I just get an understanding, the people who are on the call right now, are you also a cancer survivor, or what inspired you to come on the call, or what were you hoping to get out of the call? Do you mind just typing in the chat there so that I can see and just sort of get an idea of who's with us this evening? I'll just give you a moment just to share with us why you're here, what you want to get out of this session. And as you're typing why you're here and what you want to get out of this session, we are getting slides back. Wonderful. And I'm seeing on the back end, things are looking good. Shall we see Dr. Lee and Rena and all our beautiful support team? We have a lot of people who are supporting us tonight as well for this live stream. There are a number of people right now working on the back end to make sure that this is going to happen smoothly for us now. So I do thank you, Claire and Shanshan and Rena and everybody else that's been in the back there working hard. Thank you so much for making this happen tonight, because all of these Facebook Lives, as much as so far we haven't had too much of a hiccup. I know that I think two Facebook Lives ago when I was hosting, I disappeared and I think I froze, not in a too bad facial expression, but yes, sometimes we do get some hiccups. So yeah, if the back-end team are able to just check if the slides are moving, we can keep going. So I'm still waiting to hear who else is in the room tonight.
Hi, I'm sorry. Can you all see if the slides are moving? Do you all see the slides?
Hey everybody, I'm back. Oh my goodness. This is the second time I've done a Facebook Live where I've suddenly frozen and disappeared. And I think this time I had a wonderful facial expression like I was going to eat an apple, take a bite out of an apple. Thank you for the couple of comments of why you're here tonight as well. And yes, I would love to know the answer to this question too, Serene, which is the reason for why cancer patients are getting younger. And I have some sneaking suspicions. I'm in a healthcare profession, not in oncology, and I do see a lot of my patients and clients getting younger as well. So I do have sneaking suspicions about that. But this would be a fantastic question for Dr. Lee to address as well. And Andrew, thank you also for sharing this as well. One of the possible key reasons that cancer patients are getting younger, is due to the early detections. Exactly. So that's a plus because we are starting to detect it early and we're catching things early. But I also still feel that maybe with certain lifestyle factors and certain changes in the society in general, that that might also be contributing to why we are younger as well. Yeah, and because we're screening and because we are, I guess, actively trying to look out an early detection, we might catch a cancer a little bit earlier than if somebody had delayed it. And that's why we're doing the My First Mammo and the My First Colonoscopy, the My First PAP, in order to really try and get on top of this. And as Dr. Lee alluded to earlier, some of these cancers can really be curable, and we can really fight and win that fight against cancer if we're able to address that earlier as well. I see a couple of other comments coming in too. Thank you, Yvonne. So yeah, the food that we eat, the environment, the things we all use. Yeah, I think you're right on the money. And I remember back in the day, and I'm showing my age now, there used to be a saying, an apple a day keeps the doctor away. And over time, I come to believe maybe that maybe one apple a day is not enough. And that's because apples, just like honestly all other foods, are kind of being over harvested, and they're trying to produce apples that's not so seasonal anymore. We're starting to get apples that are stored and they get sold, months after the season has ended. And because of this sort of over harvesting and the soil's not able to regenerate all of its minerals, one apple may not have as much health, mineral, vitamin, substance, maybe as back 20, 30, 50 years ago, when apples were really just seasonal and you could only get them at a certain time of year. So yeah, definitely, I think the food and also we have a lot of hyper palatable foods, hyper tasty foods these days, both in terms of texture. The texture of foods are important, but also in terms of the taste and either sugar, whether it's artificially sweetened or not. And high fats and that sort of thing, and it tastes so good, but maybe they're also part of the reasons, these hyper processed and hyper palatable foods that we are reaching for, because it's the desire, the taste is there. And yes, GMO as well, that might be affected too. Yes, Yvonne, we won't really know too much about GMO until they do more studies on that. But yes, I'm starting to see slides moving here as well. That's wonderful to see. Dr. Lee, are you still with us? Can you
Definitely.
Oh, wonderful.
I'm waiting to start.
Wonderful, great. So what
I'm very happy that the slides are on now.
I'm very happy the slides are on. I would still love to see you live in person with the camera, but if that's not working, I'd happily take your voice and the slides. So I will leave you to it, and we can continue with the 10 most common cancers in Singapore amongst females. Take it away.
Thank you, Gary. Yeah, okay, sorry. So let's start again, and we will go right into it. So for female cancer, the first cancer that is most prevalent definitely is the breast cancer. You see this pink line here is rising at amazing rate. Next slide. But luckily for us, you see, this is the incidence rate. It is rising very fast, but the mortality rate is not really rising as fast. And that is very heartening, because we feel that this is in part due to breast cancer screening, which is responsible for picking up the disease early, which can then be totally cured. Next slide. So just a way for us to, pay special attention and to remind us what to look out for, we can use the word caution. So how do we, find out like changes in the body, which part to pay attention to? Number one, we can start with C, any change in bowel or bladder habits. For instance, I'm just going to give some example. For instance, if you go to toilet like once a day and suddenly you're like doing like 2 or 3 times, or you have constipation for 3-4 days, alternating with like increase in bowel movement on some particular days. If there is a change in regular habits, then this is something to take note of. A, for a sore that does not heal, that is recurrent, that is there, that bleeds and doesn't go away. Or U, for unusual bleeding or discharge. T, for thickening or lumps in breast or elsewhere. I, for indigestion or difficulty swallowing. O, for obvious change in wart or mole. N, for nagging cough or hoarseness. So of course, we are saying that, just pay attention to all this. If there is any change or any suspicion, just take caution, as the word showed, and maybe you need to seek medical advice. Don't sit on any changes that has been nagging at you. Next slide. So if we look at common symptoms of breast cancer, it usually appears as a breast lump or a lump in the armpit or changes in the shape or symmetry of the breast, or even like skin changes, nipple retraction, nipple discharges or bleeding or frank pain. Of course, all these symptoms can also happen and it may be associated with benign breast associated disease, but it's very important to get medical advice. Next. Some of the common symptoms for colorectal cancer, like I mentioned before, a persistent change in bowel habits, including diarrhea or constipation, or change in consistency of your stool, rectal bleeding or blood in your stool, or persistent abdominal pain, such as cramps, gas, or pain, and a feeling that your bowel doesn't completely empty, or weakness, fatigue in general, or unexplained weight loss, or if you see frank blood in your stool, then it's also important to get medical attention. Next. So some of the common symptoms of cervical cancer includes like vaginal bleeding following intercourse or in between periods or after menopause, or bloody vaginal discharge that may be heavy or have a foul smell, or lower abdominal pain or pain during intercourse. So I present all these symptoms, to pick up on for the top 3 cancers that can be easily prevented with screening. Let's move on. Next slide. So let's talk about risk factors. Risk factors can be dichotomized into modifiable risk factors versus non-modifiable risk factors. Next slide. So for modifiable risk factors, we know that sedentary lifestyle, obesity, alcohol consumption, smoking, taking hormones in the form of hormone replacement therapy, and diet can all contribute to cancer, increasing your cancer risk. Of course, like what Catherine says, she lead a healthy lifestyle, she exercise. Why is it that, I still get cancer? This is a common question that most of my patients ask me as well. Well, one of my patients happens to be a marathon runner even. Well, it doesn't mean that, once you have a healthy lifestyle, that will naturally prevent you from getting cancer. We are reducing the risk factors as much as possible, but that is not a guarantee. I think one of the questions just now on why there's a trend in increase in younger patients getting cancer, I think lifestyle could be one of the answer, even though this is still an ongoing research question. But I think, increasing alcohol consumption amongst the young, that may be also a contributing factor as well. Next slide. Some of the non-modifiable risk factors includes aging. I mean, as we age, cancer, we are predisposed to cancer because, it's a repair mechanism, and like, machines that, spoil after use. I think once we age, the repair mechanism is faulty, and that predisposes to mutation and cancer formation. Of course, family history is something that we can't modify. Family history of hereditary cancer will predispose one to getting cancer at an earlier age. So screening and family history is very important. For breast cancer per se, early menarche and late menopause, as well as delayed or no childbearing or exposure to radiation at a younger age are all risk factors. Next slide. So what we can do, we can try our best to improve our lifestyle and do what we can to reduce the risk for cancer. So we can exercise, we can drink alcohol in moderation or don't drink at all. We can quit smoking, keeping a healthy weight, and of course, discuss hormone replacement program or therapy with your doctor before embarking on it. WHO actually recommends at least 150 minutes of exercise a week and 2 days a week of weight training exercise. Of course, this is not easy, but it's something that we can strive towards. Next slide. And this is my other photos of my trip to Mont Blanc. So of course, exercising will be easier if you are doing something you really like, and also with a group of people who enjoy it as much as you. Next slide. So this is what the American Institute for Cancer Research suggests for cancer prevention recommendation. Those are really things that we have discussed, like limiting sugar, limiting consumption of red processed meat, limiting fast food, which is high in fat, starches, or sugar, be physically active, keeping a healthy weight, eating a good diet rich in whole grain, vegetable, fruits, and beans, limiting alcohol. Just do not, confuse that as long as you eat supplement, that's enough for cancer prevention. That's not true. Next slide, please. So let's go into screening. I think it's very important for us to be cognizant of the screening program that is available nationwide. So according to national guideline, women above 50 years of age are advised for breast cancer screening once every 2 years. And if you are between 40 to 49, it's advisable to discuss your breast cancer screening with your doctor. If you are going to do it, it should be yearly. And what does it involve? It really involves mammogram. So this is also in conjunction with the first memo that is driven by 365 Cancer Prevention Society. Next slide. So what exactly is a mammogram? I think a lot of you who has experienced one may feel that it is very, very painful. But, knowing exactly what you're in for, how long it is very short. It's just in seconds or minutes. It may ease your anxiety. So it's essentially an X-ray picture of the breast. The breast will be sandwiched between the two plates for the X-ray to be taken. Of course, you may experience some discomfort, but the process is usually very fast. So some tips: do not go for a mammogram before or during your period, as your breast can be more sensitive and tender, and do not wear perfume or deodorant because that can affect the X-ray picture as a result. Next slide. So for colorectal cancer screening, the screening tools is also fairly simple. You can get screening with My First Colonoscopy campaign by 365. You can get it at Singapore Cancer Society. You can get it in most polyclinic if you fulfill the criteria. Basically, the national guidelines suggest cancer screening from 50 for colorectal cancer. Of course, if you have a strong family history, or if you do have any, symptoms, you're advised to get it earlier. So essentially, it includes like fecal occult blood tests or fecal immunochemical tests, and it can also involve like colonoscopy, sigmoidoscopy, etc. Next slide. Maybe I can advise more like how it is done. So usually if you go to a polyclinic, they will advise you, they will give you this sample. So there's a sample collection, specimen collection. So you bring it home and you do the sampling over 2 consecutive days. And then once you have done the sampling, you can, put this sample kit in an envelope and mail it back to them. It's as simple as that. So you don't even have to go back there unless, there's issue with the test results and you're caught in. But this is a very simple test. Next. So if there is a positive result, then, you will need further testing and evaluation with a scope, and that is a colonoscope. And that involve, putting you under very light sedation because it may be a little bit uncomfortable, and putting a scope up the anus so that the doctor can actually see whether there are any abnormality, whether there is any bleeding, whether there's any polyp that's suspicious, and at the same time, it can be taken for biopsy. Next slide. So next screening is cervical cancer screening. So cervical cancer screening is important because, with the result, we know that it is really working to bring down the cervical cancer risk. So it's recommended for patients who are actually, for anyone, general population, females or males, females who are sexually active. The pap smear is usually every 3 years, but if the HPV testing is available and done together, the testing will then be every 5 years. Next. So how is it done? So if you don't know what is going to happen again, if you are very anxious, it may increase the discomfort. So just to have a pictorial representation, usually you have a scope which is, put into the vagina to open it up very gently, and then a very small brush is inserted, and then is taken, a sample of the brushing from the cervix is taken, and then the cells from the cervix are analyzed to detect for any cancerous or precancerous cell. Again, it is a very quick procedure, so the discomfort is very limited. Next. So again, like I say, for cervical cancer, we really is seeing very good result for flattening of the curve. We are seeing a decrease in the mortality. And for breast cancer wise, even though we are not seeing as remarkable a result as cervical cancer, but we are seeing also a flattening of the mortality curve compared to the incidence rate. Next. Okay, so this is just a cartoon to show that exercise is very important. Next. So I just want to highlight a little bit on breast cancer in young women, because obviously breast cancer is the top cancer in women, and this number is going to be higher in terms of younger patient population with cancer. Breast cancer is going to account for a higher population. So in the Western population, we are seeing about 4 to 7% of women less than 40 years of age with breast cancer. But if we look at Asian population, this number is much, much higher. We are seeing like 1/5 of our breast cancer in women 44 years and younger. While the treatment principles really do not differ from that of the older women, but considerations must be given to the numerous psychosocial issues that the young women may face. Next. So treatment in young women, like I say, is usually not much, not really different in principle, but in younger women, what are the differences? Generally for younger women, because there's a lower index of suspicion, like if they find that there is a mass, sometimes they just feel that, I'm so young, it can't be anything sinister, so they sit on it. So generally, because of this mentality, when the cancers are diagnosed, it's usually larger, more aggressive, and they are diagnosed later. The other thing is also because in younger women, the more aggressive subtype, like HER2 positive and triple negative subtypes, are more prevalent, and these cancers are usually more aggressive. The treatment, again, depends on staging. The systemic difference does not differ because it still depends on which stage and what is the biological subtype. But because the cancers in young women are usually larger, we are using more like neoadjuvant systemic treatment approach compared to adjuvant approach in the older population where the cancers are diagnosed smaller. When we talk about neoadjuvant versus adjuvant, we're actually talking about like chemotherapy or systemic treatment before the surgery, which is termed neoadjuvant, versus after surgery, which is termed adjuvant. So in addition to the psychosocial issues, we often have to consider like family history, whether there's a chance that this can be hereditary after all. And if they're young or they are, they haven't gotten married, haven't planned their family, then we have to consider fertility issues such as egg or embryo cryopreservation. Okay, next, please. So fertility preservation, why is it important? I think it's important because, we are gunning for a cure, right, for this early stage breast cancer patients. So after a cure, we want to ensure that the survivors have good quality of life. They are able to pick up their lives from before diagnosis. They are able to live, a fulfilling life of getting married and having kids, or at least, if they want, they have the choice to do it. Younger survivors basically have years ahead of them. Next. Okay, so fertility issue in young women. First, we have to establish if family planning is completed. We have to, talk with our gynae, our obstetrician, and some of the questions include, can I check my fertility level before treatment? How will age affect my fertility? What are my chances of getting pregnant after treatment? How can I try to preserve fertility? So these are very common questions. Next. So fertility 101, women are born with a fixed number of eggs, and we do know that this number declines through life. The quality of eggs also decreases with increasing age. At about 50 years is the average age of menopause. The ovaries will stop releasing eggs. Next. So the likelihood of subfertility before the treatment and during the treatment, it really depends on type of the drugs used, the dose given, the age at the point where the woman was diagnosed with breast cancer, and what was the fertility level before treatment. So it's very important that we consider fertility treatment before starting the systemic treatment for breast cancer. And we will then discuss with the patient on egg freezing, embryo freezing, ovarian tissue preservation, as well as ovarian suppression. Next, please. So the other important thing is genetic counseling for hereditary breast cancer. Of course, if you're diagnosed with a cancer at an early stage, the other thing that we have to screen for is whether it's a hereditary cancer. And for breast cancer, ovarian cancer, we often have to screen for the BRCA1, BRCA2 mutation, and that will entail a long session of genetic counseling and genetic screening. And also we have to talk about, pre-test counseling, knowing the pros and cons, decision for the testing, and post-test counseling, because it's not as straightforward as a yes and no answer, positive or negative. It can be a gray zone. And also following the counseling and following the testing, we have to talk about, risk-reducing surgery, such as removal of the breast and ovaries for risk reduction. Next. This is a cartoon that just, tell us how lengthy the discussion will be for genetic counseling, and it's usually not something that we can sort out in one session because the patient may not be ready. They may need to go back and talk to their family because that will have implication on the family as well. So it's something that really entails like long counseling session and 1 or 2 visits to sort it out. Next, please. So in ICON, we have a young women cancer program where we focus step by step on the diagnosis and treatment options for cancer. We take the patients through fertility preservation options. We do genetic counseling and testing, and also we provide psychosocial support, importantly. Next. I think with this, I have ended my talk. So if there's any question, we can discuss further.
Hey, thank you so much, Dr. Lee, for your sharing and for telling us. Well, we covered a lot of information there, all different types of cancer, everything that we needed, and even what Catherine had mentioned about being fearful of the infertility and that sort of thing, and you've been able to cover a lot of ground in a very short period of time. So thank you so much for doing so. We do have quite a few sort of comments and questions in the chat as we move through. So thank you everybody that is in the chat for chatting and discussing things. It started off, Dr. Lee, with some questions about knowing what causes cancer, especially in younger people, and you mentioned about lifestyle as well. So people were asking, how about processed food? Would that be an issue as well, Dr. Lee?
Yes, I think the WHO has quite clear guidelines on processed meat. So causal relation is not easy to prove. In fact, it requires, meta-analysis. It requires like population studies and long-term follow-up for a controlled population, controlled for confounders, etc. So causal relation is always a very difficult area to study. There can be lots of confounders, but we do know, like preserved meat, especially things like your luncheon meat. Probably, I'm going to mention a few like tasty food which we may have to avoid, like bacon, ham, sausages. All these are things which is proven like to be associated with cancer. I think the other things like what I'm seeing here, like microwave radiation from handphones.
Yeah.
All this, we probably don't have as much evidence at this point in time.
Okay. And in terms of like the genetic blood testing and that sort of thing that you mentioned as well, do you think that this is a valuable thing for people to do, or is it going to potentially create, I mean, I understand with some screenings, your normal health screenings, that sometimes there could be some false positives or something that might, affect us mentally, emotionally, with anxiety and sleepless nights. So where do we sort of draw the line in all of these sort of testings?
Yeah, you are very right. Genetic testing is not for everyone. It's not for general population. So I think it's very important to understand your personal risk as well as your family risk, family history, family risk. So usually what we do as oncologists, we generally test the index patient. So if a patient come to us with young onset cancer, like for instance, I see a lot of women, below 45 years of age who presents to me with breast cancer, either early stage breast cancer or advanced stage. So for these women, they are considered to be index cases, right? Because they presented with the disease. And if they presented young, they should be tested genetically to see if they have the hereditary breast or ovarian cancers, which are responsible for their cancers in the first place. If they tested positive, then we will advise stepwise for the family to be tested as a cluster testing format. Generally, if we engage like cluster testing, we do refer them to a tertiary center and a restructured center where they collect, a data set of all these patients in a cluster setting. And we do refer to National Cancer Center or even NCIS, National Cancer Institute, which is NUH, for cluster testing. But otherwise, private oncologists do genetic testing in a clinic. So you can always contact us if you're interested to do genetic testing, especially if you have a very strong family history, like if you have immediate like first degree or second degree relative with like breast or ovarian cancers and they were not tested, or somehow they were missed and you would like to be tested, you can get contact from us and then get tested. But I think the other thing you mentioned is the gray zone. I think you're quite right on that, because that's also something which we often discuss in genetic counseling. You may not just get a positive result or a negative result. We also have this gray area, which we call variant of unknown significance. So that's what we call VUS for short. So when it's a VUS, it means that at this time point, there isn't enough evidence whether this mutation is associated with a positive disease or a negative disease. But with time, when the data set gets bigger, we can then have more confidence to call this disease a positive or a negative one, the result a negative or positive one. So some people may not be able to deal with this gray zone, this VUS. Then it is something that you have to consider before making the decision to do a testing.
Yeah, definitely. And I just had a question, because you were talking about, especially for the female cancers, and you mentioned something that sort of struck my mind, which was about having that family planning and whether it was freezing eggs or whether it was doing something or having that in mind. So I'm just curious, what would happen if somebody was diagnosed with cancer when they were pregnant?
Yes, that's a very valid question. I do treat and I do research with this focus for pregnancy-associated breast cancer. One thing is not all is lost. Years ago, people may may advise you, you have to go for an abortion because you are pregnant, and then you have cancer, you can't get treatment. But now, we are learning more about pregnancy associated breast cancer, and we do know that it doesn't mean that you definitely have to go through an abortion to safeguard your life. Usually the treatment for pregnancy associated breast cancer is a tricky one, because you have to balance the benefit to the woman, the pregnant lady who is the mother. Of course, you want to treat the mother, but you also have to balance the side effect and the danger the chemotherapy pose to the fetus. So it's a balance, and usually it's on a case-by-case basis. So it's very important, like when the woman was diagnosed, at which trimester. Usually during the first trimester, we do not recommend giving chemotherapy, but in the second, third trimester, we can confidently give chemotherapy to these patients, and we work together with the obstetrician to monitor the fetus, while at the same time, we give chemotherapy to treat the mother. And if they are now, if they want to do like surgery first, surgery is actually possible to be done safely at all trimester, and that is proven in studies and in literature. So, I did my fellowship in Dana-Farber Cancer Institute, where I was working with pregnancy-associated breast cancer. We were giving chemotherapy for second trimester, third trimester patients. Their outcome is usually very good. In fact, there is a study that studies the outcome, the fetal outcome, in terms of IQ, cardiovascular system, connection, etc. And we see that, there is no detrimental effect compared to control. And the only thing that affects IQ is how term the baby is. So it's advisable to carry the baby to term, and other than that, the chemotherapy doesn't affect. So it's very heartening to know that too.
Yeah, that is very heartening. Thank you so much for sharing that. I don't see any other questions coming through right now. So if you have a final question, I'm just going to give you 10 seconds to punch that in. But if I don't see any more questions, I would like to thank you, Dr. Lee, for your time this evening. And even with all the hiccups, you were still able to get your message across and share this vital information. So if there are no other questions, I'd like to thank you one more time for being here this Saturday evening.
Thank you very much.
Not a problem. So now it's time for Dr. Lee to take her leave. And before we close tonight's session, we'd love to get some feedback from you from tonight's session. So, we value you being here, and we value all of your comments here as well. So please also type in the comments your thanks for Dr. Lee, and maybe something that you've learned tonight as well that you could share with other people. But also let us know what other topics or what else would interest you, so that we can curate more Facebook Lives that will benefit you the most. So if you can take a moment just to complete the feedback form, that would be great. I think you can also see the link to the feedback form in the comments there as well. And I would also like to quickly tell you about our next 365 live session. So this will be on the topic of colorectal cancer. And as you've already heard from Dr. Lee, prevention is definitely better than cure. And so you would love to tune in for this. It's on the 25th of May, right here, same time, same place on our Facebook platform. And also just one more reminder about our 3 campaigns, the My First Colonoscopy, My First Mammo, and My First Pap Test. So as Dr. Lee mentioned, these screenings are valuable to catch things early, and especially for younger generation, because sometimes, as she said, they may tend to leave it and ignore it and go, you know what, I'm still young, that's not a problem. but we do want to also offer these for people who are unable to get access. So please help us to donate, and also please share this with other people who may be needing this early intervention and early detection. So these screenings are going to empower people like you and me to start proactively taking steps towards an early detection and, of course, a healthier future. We would love to have support in terms of funds as well. So please take a moment to donate, as this would go a long way in helping the people around us receive the treatment that they need and they deserve. All right, so I'm going to finish up and just say, please check us out on our social media channels for all the latest updates and our events exactly like this 365 live event. And I want to thank you once again for spending this Saturday evening with us. My name is Gary Tho. I've had a pleasure being here and being your host for this evening, and I really hope to see you guys at the next session. So until then, stay safe and be happy. Have a good night, guys.